Dr. ADITYA KELKAR. Good afternoon, please.
Hello, good afternoon everyone. Thank you APAO for this opportunity. I'll be presenting my work on comparison of phacoemulsification with dexamethasone implant compared to an anti-VEGF injection, which is aflibercept in this case, in management of coexisting cataract and diabetic macular edema. So no financial interests. So very often you come across patients who have diabetic macular edema and cataract, and these patients do not wish to go to the operating room too often, and therefore there's always a good idea to combine cataract with injection therapy. So there are individual studies that compare anti-VEGF and steroid implants. However, there are not many comparative studies which have a combined phaco plus dexamethasone implant comparing it with the anti-VEGF therapy, and that's why we set out to do this retrospective analysis. So this is a study period between 2020 and 2023. We have 54 eyes that were treated with phaco and dexamethasone implant, and we had 47 eyes that were treated with aflibercept injection along with phacoemulsification for coexisting cataract and diabetic macular edema. The key assessments were visual acuity, anatomical outcomes at the time points, specifically at baseline, 1 month and 3 months respectively, and also the secondary outcomes in terms of importantly the intraocular pressure variations and the subgroup analysis based on presence and absence of hard exudate at the same time pre-existing treatment. So the results of the two groups were quite comparable. With the anti-VEGF group, we achieved a visual acuity gain from 1.02 to 0.49 logmar, very similar to what we achieved in dexamethasone implant, slightly better though, was from 0.93 to 0.38 logmar. We also tried to compare it with the treatment naive group. I'm sorry about calling this as a recalcitrant. I would rather call it as a recurrent diabetic macular edema, where these patients were previously treated, and we realized that the results are quite similar in both the groups when it comes to treatment naive or those patients who have had treatments in the past. At 3 months, the central macular thickness reduction was quite similar again, 293 microns with dexamethasone implant compared to anti-VEGF group, although dexamethasone implant does a little bit better than the anti-VEGF group. Similar results once again when it comes to central macular thickness for treatment naive group as well as those patients who had a recurrent diabetic macular edema. Post-operative intraocular pressure elevation as expected was more in the dexamethasone implant group, but it was only 14%, which was well managed with anti-glaucoma medication as compared to only 2 eyes in anti-VEGF group. No significant difference of intraocular pressure outcomes at 3 months that were observed. What we would like to reiterate is that most of these patients who had dexamethasone implant at the time of end of the study protocol of 3 months, none of these patients required a re-injection as compared to about 30% of the patients at the end of 3 months as expected were due for another injection. So combined phacoemulsification with intravitreal therapy, either steroid or anti-VEGF, especially the longer acting like aflibercept, is a very effective treatment modality to address the two comorbid conditions at the same time. The surgery-induced inflammation can be exacerbated because of and causing macular edema to worsen, and therefore a steroid therapy probably has a better role compared to the anti-VEGF therapy. Both dexamethasone and anti-VEGF significantly improved the visual acuity and central macular thickness at 3 months, and dexamethasone implant showed greater anatomical improvement compared to the anti-VEGF group. However, the visual acuity improvements were quite similar, and as expected, the dexamethasone implant group had a transient IOP elevation which was normalized at the end of 3 months. The limitations of the study include the retrospective design, non-randomized, and of course the shorter follow-up time. Thank you.
Thank you. Any questions?
Yeah, a very nice paper, Aditya. Because the half-life of the dexamethasone implant and the anti-VEGF drugs are different, do you think there's an advantage in injecting these medicines prior to the surgery? And if so, how soon before, how long after the injection would you do the surgery?
Yeah, as a standard protocol, we would like that the patients have the macular pathology stabilized prior to undergoing cataract surgery, but many of these patients have logistic issues where they don't want to come in for injections and surgery separately. So it's a good idea probably to combine these two procedures at one go.
Any more comments or questions? Thank you.